If I told you that there is an easy way to detect and treat colon cancer, would you do it? A colonoscopy can be a life-saving screening tool when it comes to early detection of colon cancer, which may be curable. Although colon cancer is the second most common type of cancer in men and women in the United States, even more deadlier than breast and prostate cancer, it is the #1 preventable cancer. The number of new cases of colon cancer in 2014 was estimated to be 136,830, and an estimated 50,310 people will die of this disease. Colon cancer represents 8.2% of all new cancer cases in the United States. Colon cancer is more common in men than women and among those of African American descent. Colon cancer is most frequently diagnosed among people within the age of 65 and 74. The death rates increase with age. Compliance with screening further assists in early detection of colon cancer, which may be curable. A colonoscopy is a procedure that is done by a specialist that allows the examiner to evaluate the inside of the colon and, if needed, take biopsies of anything suspicious. The specialist uses a long, narrow, flexible tube with a tiny light source at the end to visualize if there are any ulcers, polyps, irritated tissue, or cancer. The goal of colorectal screening is to remove polyps prior to them becoming cancerous. Your doctor will most likely recommend your first screening at age 50 unless you are at a higher risk for colon cancer. Anything that increases your chance of getting a disease is known as a risk factor. Having a risk factor does not mean that you will get cancer, and not having risk factors doesn't mean that you won't get cancer. Risk factors include a family history of polyps or cancer of the colon, a personal history or inflammatory bowel disease, or if you are obese or a smoker. A colonoscopy can also help your doctor to determine the cause of unexplained symptoms that you may be experiencing, such as a change in your bowel activity like diarrhea or chronic constipation, blood in the stool, abdominal pain, unexplained weight loss, or rectal bleeding. People usually avoid having a colonoscopy due to the fear of it. Colonoscopies are usually avoided by people because the procedure is known for being unpleasant, painful, and embarrassing. Most people do not like the prep that they have to do before the procedure. They can only drink clear liquids and have no solid foods one day before the procedure. They must also drink a solution called Go Lightly or take many pills, which will help completely empty the colon for good visualization during the procedure. Along with most procedures, there are going to be fears. Ask any questions that you may have before the procedure. The doctor will go over the procedure with you along with any risk or possible complications that could occur. You will also receive conscious sedation during the procedure to help with possible discomfort and pain. Like with most procedures, there are risk factors associated with a colonoscopy. They include a small chance that the scope may tear the lining of the colon and cause a perforation, chance of infection, chance of bleeding as a result of the removal of polyps, and the possibility of having an adverse reaction to the medication given to you during the procedure. Depending on your stage of cancer, the doctor will sit down and discuss which treatment plan might be best for you. Treatments can include surgery, chemotherapy, radiation, or targeted drug therapy. Be proactive. It's your health. March is recognized as National Awareness Month for colon cancer. As we all grow older, there are certain tests and procedures that we need to have done for early detection and prevention. You will be told by your doctor that you will need to have your first colonoscopy at the age of 50 and then one every 10 years after that, unless you have had a family history of colon cancer or polyps, a personal history of an inflammatory bowel disease, obesity, or if you are a smoker. Most people usually experience fear when they are told it's time to schedule their colonoscopy because of the discomfort or pain that they could experience, or just because it's an embarrassing procedure to them. A colonoscopy is a procedure that is done by a specialist that allows the examiner to evaluate the inside of the colon and, if needed, take biopsies of anything suspicious. The number of cases and deaths associated with colon cancer increases each year. Colon cancer is usually diagnosed between the ages of 65 and 74, and the death rate increases with age. With early detection of colon cancer, which is the second most common cancer in men and women, also remember it's the number one preventable cancer. The prep associated with the colonoscopy can be unpleasant. You must stay close to a bathroom because the prep's goal is to completely empty the colon for better visualization. The risk associated with the procedure can be bleeding, infection, a tear in the lining of the colon. If detected early, colon cancer can be curable. Please follow the guidelines for when it is time to have a colonoscopy. Colonoscopies can be a life-saving tool for early detection of colon cancer. You don't need to be in healthcare to help people become more proactive. I encourage every one of you to spread the word and tell family and friends who might not be aware of the guidelines for colon cancer. You could not only save your life, but also the life of a family member or close friend. Take action. Don't let colon cancer beat you, and make a difference in someone else's life.